Hello, and welcome to our webinar on leveraging technology to manage real-time acuity and facilitate self-management and self-independence for older adults. My name is Laura McKee, and I'm co-founder and COO of Hucu.ai, the first truly person-centered messaging network with risk ratings built in. We're excited to have so many members of the aging community join us today to hear how our innovative partners at Clearfield County Area Agency on Aging are providing person-centered care, managing acuity, and empowering their team. First, I'd like to put this conversation into a little context. As most of you are aware, the Census Bureau and industry experts like N4A have reported that 1 in 5 Americans will be 65 or older by 2030. 90% of them say they want to stay in their homes. Meanwhile, technology is evolving rapidly. The AARP reported more than a year ago that 77% of people over 50 use smartphones, and we know that number continues to go up. And perhaps most importantly, value-based care is driving a need for more person-centered care. The Center for Medicaid and Medicare now has billions in incentives available to providers who reduce hospitalizations and improve the quality of care and the quality of life for seniors. Payers and other risk-bearing healthcare providers need the help of CBOs like AAAs. And as a result of all of these fundamental trends, innovation is absolutely necessary for area agencies on aging to thrive and to fulfill their mission of helping as many people as possible with the limited resources that they have. That's why we are so fortunate to have Kathy and Ethen here to share their approach to addressing these opportunities. Let me tell you a little bit about Clearfield County Area Agency on Aging and their dynamic duo. Clearfield County Area Agency on Aging is one of the 622 AAAs across the U.S. empowered by the Federal Older Americans Act to improve the quality of life for aging Americans. CCAA serves more than 1,000 older adults in Western Pennsylvania and provides a full range of services, from protective services, home-delivered meals, community education, to home health care. Kathy Gillespie has over 30 years of experience in geriatric care. She is a charter member of the Dementia Specialty Council for Pennsylvania Healthcare Association and is also certified in healthcare compliance, the Ethen Alternative Person-Centered Care Method, and dementia practice. Kathy has been CEO of Clearfield County Area Agency on Aging for nearly a decade. Ethen Tarner joined CCAAA as a project manager nearly 7 years ago and progressed to corporate compliance officer and has been chief operating officer for 3 years. He's been a member of teams that have captured multiple awards, including an Aging Achievement Award from the National Association of Agencies on Aging, and a Fast Company World Changing Idea Award as part of the Village of Hope project. Ethen holds an MBA from Clarion University and an MA in Applied Behavior Analysis from Ball State University. And he was pretty happy with Penn State's opening football performance last week, as he has a BS from Penn State. So our goals for today are straightforward. We want you to walk away with a practical understanding of how CCAAA has been able to provide proactive care using real-time acuity scoring, how they use data analytics to improve team performance and operation, and how they're streamlining communication within their internal teams and soon with patients, families, and external parties. So I'm going to ask Ethen and Kathy a few questions. But before we get into the questions, we'd like to launch a poll for all of you participating today to indicate what some of your biggest challenges are in supporting your consumers. So we'll give you just a minute to respond to this poll, and you can select multiple items. We'd like to know what the biggest challenges you have in supporting your consumers. Does it involve care coordination and collaboration, managing consumer acuity levels, lack of funding, inflexibility of funds, getting families and support systems engaged, inability to gather and synthesize data to support funding, meeting regulatory requirements, providing clients access to care, hiring and retaining staff and volunteers, Please let us know which of these are the most critical of the challenges that you're facing. So it looks like care coordination and collaboration is a pretty big need. Getting families and support systems engaged is a pretty big need. All of these really seem like challenges that our audience is facing. So let's get into it a little bit. Let's discuss how those challenges are impacting CCAA and how you've responded to those challenges. So Kathy and Ethen, talk to us a little bit about what the biggest challenges you've faced in supporting your consumers are.
For our particular agency, organizing care for thousands of seniors in need requires us to be more efficiently and effectively able to manage our team with case assignments and to project the number of FTEs needed in order to mitigate risk that our consumers have. And also to be able to identify those individuals who need more case management time than otherwise other people would need.
Got it. Anything you'd like to add to that, Ethen?
I would just say that our consumers are often served by complex networks of providers and family systems. So being able to integrate them all into one platform was something that was very important to us.
That makes a lot of sense. And how has Huku helped you? While you're sharing, I will share a screen that shows what Huku actually looks like. And if you can talk a little bit about how Huku has helped you, that would be fantastic.
So for us, Huku provides real-time acuity scoring at the patient level and consolidates multiple assessments together for easy availability and access. One of the things that we also were looking for was a way to measure the acuity of our consumers and be able to implement real-time interventions to mitigate risks for hospitalization and institutionalization. In addition, we really were looking for data and analytics to validate and measure our outcomes. And so we were fortunate when we began working with Huku to be able to actually identify flags and risks and also gaps in service that otherwise we were not aware of, so that we can create person-centered planning and meet the needs of individuals where they are in place.
Very cool. Ethen, can you talk a little bit more about how the data analytics have helped?
Yeah, definitely. Something I especially enjoy is being able to hop into Huku and seeing the acuity score of the patients, kind of just the risk that we feel they're at in that moment. So the consumers have rings around them that are color-coded and also a score that corresponds with a risk. So having that available is very important. Previously, we were using Microsoft Forms to collect information, but that process was labor intensive and we had to export the information into an Excel file and then had to convert it from there into usable information. So Huku makes it very simple to just click on a consumer and see where they are as far as their acuity score. Also, we can track the number of patients that we have, the percentage of patients that we've given assessments to, so there's no guesswork in how many of our patients have been assessed, how many assessments our caseworkers are doing. So we have that information available whenever we need it. So this page has been very nice, Laura, because we have a screen system around our office, and we're able to almost make a competition out of who's doing the most number of assessments or getting them done the most efficiently. So we're able to post this graph and show who's leading the number of assessments that are being done.
Yeah, and if I can add to what Ethen said, it also helps us project the staffing levels that we're going to need, right? So the higher the risk consumers that we have, the more intensive the case management needs to be, and therefore additional staff may be needed for those individuals at high risk.
Absolutely, that makes sense. So we want to use our time really wisely, and we really only scheduled 30 minutes, but we'd really like to hear more about what your vision for CCAA is. Where do you see your organization going, and how can Huku help you get there?
Right, so our vision for the Clearfield County Area Agency on Aging is to have real-time collaboration with all members of the consumer care team, including primary care, behavioral health, any consulting specialists, because historically we have had to send faxes, leave messages, wait for calls back, in order to gather information necessary to implement a care plan for consumers. So Huku is going to allow us to create channels specifically for collaboration where all members of that individual's care team, regardless of whether they're inside the Area Agency on Aging or outside providers, will be able to collaborate together so that we can have the best outcomes for the consumers that we serve.
And that's what it's all about, right? The best outcomes for the consumers you serve. That's fantastic. Do you have anything to add to that, Ethen?
I would just say Kathy and I share that vision, and even though we live in a rural county in Pennsylvania, we feel that our consumers deserve the absolute best and cutting edge technology that we can offer. So that's what's led us on this quest to be able to respond to people whenever they need us to.
Wonderful. We do have a Q&A chat. If those of you participating in the webinar would like to click on the Q&A bubble at the bottom of your dashboard there in the Zoom application, you can put questions in for our panelists. And while we're waiting for those to come up, we will ask another poll question. So this question is about what strategic opportunities you're most interested in to improve your agency's impact. So of these potential options, we're really interested in knowing what your opportunities are most aligned with. Do you see yourself leveraging technology, increasing access to data to improve operations and get more done? Are you reducing staff turnover? Are you improving relationships with risk-based payers? Are you identifying increased funding opportunities and expanding programs to serve more consumers? Which of these strategic opportunities are closest to your priorities? Huku has been designed to support AAAs in delivering services to their consumers and in helping them access more of these strategic opportunities. Here's a question. How long did it take to get Huku up and running for your team? Ethen, you want to take that one?
Yeah, I'll do that. The Huku launch was broken into two parts for us. We started out with just our protective services unit using Huku. So we did a quick webinar, I think it was about 20 minutes, to show everyone how Huku works, what the overall goal was with it, and then we launched it with them. We put the app on their phone, we put a link on their desktop, and they were able to access the system. It went pretty smooth. People didn't have a whole lot of questions. So then we were able to roll it out to the rest of our care management team. We did another webinar, about 20 minutes, did the same process of putting the app on their phone, setting up their accounts, and they were off and running and able to access the system and use it. And we've been doing pretty well. We don't run into a lot of issues, a lot of questions, comments, or concerns from our staff. So the rollout was pretty smooth.
Excellent. Thank you. I'm going to go ahead and share the results of our poll. Looks like the majority of participants are prioritizing expanding programs to serve more consumers, increasing access to data to improve operations and get more funding, and leveraging technology, followed by identifying increased funding opportunities. That makes a ton of sense given what's going on in the AAA world and the aging services world in general. Here's another question. How complicated is it to maintain and support Huku?
I'll grab that one too, Laura. It's not super complicated. I go in every once in a while just to take a look at the database and ensure that everyone is in there that shouldn't be, that our folks are using Huku. You're able to go in and see the last time your staff have accessed the system. And I also just remove any consumers that our care managers may have missed discharging But overall, to support and maintain Huku is not a heavy lift on the IT side.
Got it. And here's another question. Our protective services and care management staff do not have agency phones. Would this work well without the phone access feature?
Whenever we first launched Huku, actually I can speak for myself. I don't have an agency phone and I don't have Huku on my phone. I simply use the website version and it works very well. The benefit of using your phone is being able to do the assessments with the consumers in the field. But if your agency has Wi-Fi access for your computers in the field, then you can complete those assessments as well.
Thank you. Yes, Huku's designed to work on any web-enabled device and also on iPhones and Android. So we do have customers who use a bring your own device policy. And because Huku doesn't use the same level of resources as other apps, it's been very successful for people, who want to access the information on the fly. Here's one more question, and we're open to more questions if people have them. How did you find the budget to pay for Huku? Kathy, do you want to take that one?
Sure. So initially when we first started with Huku, we simply made that part of our annual budget, right? So we typically have software updates that we complete annually, and we rolled the cost of Huku into that. Since then, we have evolved, and we actually roll that right into the service plans of each of the consumers. So each consumer has the Huku device or application as part of their care plan, so it's rolled right into that for the cost.
Thank you. Are there any other features that you would like to share with the audience that I can pull the screen back up on?
Laura, if you could show the acuity rings, the red, yellow, green.
Can you see them now?
Yep. So especially if you go to the plus arrow, as if you're searching for consumers, it makes it very nice to see the acuity ring. You can scroll down through your caseload and see the rings very quickly. So it gives you a quick and easy way to see how severe your consumers' needs may be. Also with the flags, Laura. So we custom set a set of flags that look a little bit different than these ones, but ours are specific for our agency and the things that we think are important that our staff need to know or be aware of, or something that needs to be done. So for example, we have a flag for cognitive impairment or dementia. That's for consumers that have that issue going on for them. And we also have another flag that is a spouse as a caregiver. So we feel those are two very important things, that if those flags are up, that consumer may be at a greater risk. So we know straight away that those people need more attention from us. So that's been very helpful. Another nice thing about Huku is whenever our staff collaborate with each other, you're able to get honor points. And yep, right there on the side. So if somebody does something that we think is above and beyond or hits the mark, we can give them an honor, and they collect over time and people can see how many honors they've gotten. Right there.
Yeah, I would add to that that we have implemented in our agency the credentialing of our case managers to implement evidence-based programs for those individuals who may benefit from them. So adding a flag for individuals who are hospitalized or come out of the hospital enables us to identify those folks and how many of them go through those evidence-based programs, and be able to measure the outcomes of those that we will be able to use as evidence for our value-based programs to managed care organizations as well. And based on the acuity again of the individuals, we reassign new cases to those care managers who have less acute consumers on their caseload, so that it's more fairly distributed.
Thanks for speaking to that. So we really appreciate people taking time out of their busy days and sharing some best practices and innovation with us. Thank you so much, Ethen and Kathy, for sharing your expertise and your experience. We hope that this has been useful to you. And if you found it useful and you'd like to talk with Huku further about exploring the possibilities for your organization, please reply to the email that you used to sign up for the webinar, or visit our website, Hucu.ai. We'll put that in the chat, and everyone who's interested can visit our website to learn more and send us a message. Any last words?
I would just say that, you know, currently with the situation with the lack of direct care workers, and so many families who are raising their own children and holding down jobs, you know, Huku does offer the ability for those individuals to receive real-time information on the status of the services being provided to their family members. So it's a great way to communicate with families who otherwise are working at the times that the agencies are open as well.
Thank you so much for that last word, Kathy. It's our mission to help people like you two and all of your incredibly hardworking staffs who are often working in geographically dispersed areas and under difficult conditions. And we hope that Huku will provide you with the support to continue to serve your consumers at the highest level possible and get the outstanding outcomes that Clearfield County has been recognized for. So thank you again for taking the time with us, and we'll look forward to the next time.